of concepts and ideas today that I think could be utilized really quickly to help support some of the challenges that healthcare organizations. But I also want to, make folks aware that I'm also very aware that, HIPAA and high tech and other regulatory bodies do play a part in this whole process, and that's often a bigger conversation. So just a little disclosure there. All right. So again, how this all started is I did a kind of a rapid solution for a large healthcare provider in Toronto, and it was really focused on e-visits. And that had a pretty significant impact on, my understanding of just how challenging um, it is to work in the healthcare industry, and how often a lot of the systems and processes are a bit more rigid maybe than other industries, and for good reason. People's lives are involved, so it can make it very challenging to adapt to specific situations, as they rise super quickly. Also, we've talked a little bit about the regulatory issues, and then you have EMRs, which I'll get into in a little bit. But they're very, very, very expensive environments, very difficult to change on the fly, and are very powerful, but not always super flexible and nimble, and not that thing that maybe you could react to a situation within a couple days. Now, I'm sure I'm going to maybe get some hate mail from folks like Epic and Cerner, but just having worked in that environment, those are very big, and also very, kind of focused environments that always, you can't necessarily pivot on as quickly as you might like. So what I did was I started talking to folks about, what are the challenges that healthcare organizations are facing because of COVID right now, and which ones potentially could M365 and Valo help tackle. So what we're going to get in today is kind of basically a thesis on my end, where I've taken some of the solutions I've already implemented and kind of tried to expand upon it, and really want to have a conversation about these different items and talk about how I think that these tools could really support healthcare moving forward in the future to help them react to a situation like COVID or any other natural disaster or pandemic or whatever the case may be. So just to let you know, I did a lot of homework. So I talked to a bunch of hospital administrators, a couple nursing professors, one chief nursing officer for a large healthcare in the Southwest system in the Southwest, a bunch of docs, 6 nurses, and 6 support staff. And these support staff were generally in the logistical areas, but also, in the sort of intake, administration, billing as well. So I collected a lot of information over the course of 5-6 weeks. And from that, there were probably 30 or 40 major things that were challenges to healthcare systems right now. But I tended to focus on just those items that I thought we could potentially help with, leveraging the M365 platform and Valo. So this quote kind of stuck with me, and this came from a chief nursing officer. And what she said was that, unlike other industries, access to the right information at the right time can mean the difference between life and death. And she gave me a couple examples in terms of maybe, if you're fighting a pandemic, you need to change your approach in a specific area, or if they're using certain types of, preventative measures or whatever it might be. Often with these situations, there's a lot of unknowns, and so folks do their best. But as new information comes out, getting that information in the hands of multiple parties and having that content targeted is really important. So looking at something like Valo and SharePoint, definitely those capabilities are there with tagging and targeting of content types, etc. But that really stuck with me, that unlike maybe like finance or supply chain, yes, you can lose lots of money if the right folks don't have the right information, but definitely in healthcare there's more of a life and death component to it, which is worth considering, as we look at healthcare in the future, and being able to respond quickly to different situations. So these are the challenges, and I'm just going to go down, and then we'll start tackling these. How to support e-visits between patients and loved ones. So this is a big one. I got a ton of feedback on this, and we'll dig into it more. But definitely there's been a huge demand, and I think healthcare systems have been coming up with some pretty creative solutions. But there's definitely a lot of opportunities there. Forms, processes, and workflows. How do I react quickly when suddenly I am gathering information from individuals and I have to treat them in the parking lot of my hospital as opposed to in my hospital, or I have to set up a whole separate physical facility, maybe in an abandoned school or an arena or whatever you're doing it, how do you rapidly set up environments to support these sort of scenarios where you're outside the norm of your parameters, of your processes and procedures and governance? You're now, it's like the wild, wild west, and you've got to react quickly. So, how can you rapidly put together forms, processes, workflows that will help you support, those different scenarios? Next, I talked a little bit about EMRs. They're a bit inflexible and they're very expensive to modify. I've heard quotes that some healthcare systems have spent somewhere in the neighborhood of 150 million, 200 million for their EMR systems, and that any major change means you have to bring in consultants to make those changes, or you have to have very expensive folks on staff to take care of it. So again, very powerful at what they do, very necessary, but also more focused on a very specific mission that isn't always going to be able to respond to rapid critical situations like a COVID-19 pandemic. Employee communication, of course, that's kind of at the heart of what we do here within Office 365. That's in communication and collaboration. But you've got folks working, lots of hours, in silos, distributed with different roles. How do you get them all together? How do you help them communicate? Next, telehealth. Now, telehealth's a big topic. I'll talk a little more about that. And there are companies out there specifically that have devices. For example, if you're diabetic, you can take that and it stores the information online, and your doctor has that. I'm not so much talking about that. I'm talking more about what happens when you have a ton of COVID patients and some of them get to go home and you need the bed space, but you want to stay in contact with them. You're not quite ready to be done. You want to check in with them every day. You want to see how they're doing. You want to be able to schedule meetings with them or have them schedule meetings with you and communicate securely with them. So taking advantage of the team, for example, like Teams, SharePoint, etc. So there's some very kind of low hanging fruit from a telehealth perspective that you can take advantage of within the M365 space. Scheduling and screening. I think this kind of goes back a little bit to the forms and process. If all of a sudden you are inundated with people who are wanting to get COVID-19 tests and get results, and you need to schedule appointments and people coming up and coming in, maybe the existing EMR system that you're using isn't quite responsive enough, or you need to expand out from 1 to 9 different, virtual locations, physical locations, again, parking lots, arenas, wherever. You need to have a way to gather information, to schedule people, and to store those results. And you have to be able to do it securely as well, obviously, and then have traceability and governance. And you've got to be able to react to that. So, we didn't see COVID-19 coming. And so we didn't have a lot of processes or contingencies in place, and now we have to react to them. How do we do that really quickly? Where we can go through and create some automation, some tracking, making content available to the end user to enter and gather and schedule up their time, and et cetera. So temporary healthcare workers. This one was a surprise to me, but because of the influx of so many cases, there's been a huge boom of folks working in healthcare systems they don't normally work in, or maybe they're pulling them from other regions. So a lot of folks, for example, my sister's a nurse in Louisiana, and now she's working in Wisconsin because they had a particular outbreak there, and it was pretty slow in Louisiana at the time. Now she's going back to Louisiana because they're ticking up. But it's not uncommon in these scenarios to pull healthcare talent from other regions whenever possible to try to backfill the massive demand for healthcare talent and support that's required from something like COVID-19. And then, of course, how do you make this all mobile? How do you make it mobile in a way that you're compliant and in governance, but also that you can give access to things like scheduling and calendaring and forms and all the things that you need to rapidly take care of business. So those are the kind of core areas. As I said, there were probably about 30 other areas that came up, but I felt like these were the ones that you could actually leverage Valo and M365 to do something, to maybe help healthcare systems create a digital healthcare workplace to kind of respond to some of these situations. So we talked about the EMR piece. They're great at doing things like lab results, imaging, billing, expenses, tracking, doctor notes, and whatnot. But if I need to create a whole new business process to support, say setting up a parking lot where we're going to be doing testing, and I want to give people remote access to schedule those tests and come in really quickly, they're not going to be. It's going to take a second. And so there are lots of other solutions like M365 and Valo where you can do that a little more effectively. Also, super expensive to make modifications to, et cetera. So, using these out of the box tools, you can sort of, continue to let the MR do what it does well, but, have set up an environment where you can be a little more responsive, and set up a system in a matter of a day or two, as opposed to, trying to get a consultant in and making changes to this, production EMR system. So again, great at what they do, just a little more focused on specific activities and not necessarily going to be as responsive or nimble as you might want. E-visits, and I'm going to get into this a big one, but there's lots of ways to do an e-visit. We have Zoom, we have Teams, we have phone calls, we have our phones. The problem is it's kind of hard for healthcare systems to manage that whole process. How do you provide a web link with a form for a loved one or family member to schedule an e-visit? How do you take care of doing the video conferencing piece securely and making sure that only the right people have access to that? How do you schedule that? How do you track it? Where's your accountability or traceability with that, so that you can show all your e-visits in case you get audited? So instead of just saying, "Oh yeah, we'll do a Zoom meeting," or "Here's a phone call," healthcare organizations have a pretty heavy burden of governance where they have to show kind of basically every action that pertains to what's going on with a particular patient interaction. So, leveraging things like MS bookings and Teams and Flow, we can kind of create a broader, more management platform that also allows folks to schedule their appointments, get email reminders, have it added into their Outlook, get text reminders, do appointment tracking. And then also from a coordinator perspective, assigning resources from a scheduling, like I need that video conference, on the cart rolled into patient A in room 303, for 30 minutes between this time and this time. How do you coordinate all that? How do you schedule it? And how do you do it seamlessly? And it's pretty straightforward to do that leveraging MS Bookings, Teams, Flow, and SharePoint as well. So, and then also getting that data out for reporting and compliance is very important. We talked definitely about forms and process. We'll get in more into that here in a second, but the key is, how do I rapidly come up with a way to gather information, get that information into the right place, slice and dice it the way I need it to, get it into the right hands, manage it, have traceability, governance, et cetera. And how do I do that in hours or a couple days as opposed to weeks or months? And that's something we'll speak to. Employee communication. I think this goes. We all are very familiar with Valo, and we all know, how SharePoint works. I won't spend too much time, but definitely it's a good tool for coming up with your focus content, your targeting, your tagging, your content types, and making sure that the right content gets in the hands of the right folks, leveraging the core sort of out of the box functionality that's available in SharePoint. I probably won't spend too much time because I think we're all pretty familiar about this. But definitely a huge component for supporting healthcare systems. Telehealth, as I was saying, there are definitely companies that this is their focus and more device integration. But there's a lot of things that we can do to support outpatients and support providers trying to support them. And also, you can use folks like PAs and nurse practitioners to help support those folks as well. And just having the ability to connect with them, schedule that, track it, have the notes from it, record the sessions, and have that interaction with the patient so they feel better, really goes a long way to improving the quality of care. Scheduling and screening. Again, how do we create forms and workflows to rapidly take care of this, have traceability, track it? So you're probably seeing a pattern here. It's a lot of the same sort of functionality we might take advantage of. But how do we, instead of having to spend a month or two trying to put together a new process in the MR, how do we use M365 and Valo to do it in a day or two? And then, again, with the healthcare workers, every time I start a new job, it takes me like 2 weeks to get my bearings. It seems like, where's my expense reports, where's where's the bathroom, et cetera. I can only imagine if I was a healthcare worker dropped into a situation, and this has been a lot of written cases about this, where there's been a lot of confusion, or they couldn't get what they were looking for simply because they didn't have access to the right information. So the ability to potentially put together a temporary employee portal where all that information is there, and that's something you can put together. They can make requests. It seems simple, but it's a challenge right now for them, and it's just something that's not necessarily readily available in a lot of systems, especially when you've got an influx of suddenly your workforce goes up by 60%, and that 60% is temporary workers. So having a way to kind of manage that, collaborate, communicate, and empower those individuals, especially mobily, to get access to the content they need, goes a long ways. And then mobile access, not too much, but the whole goal is that hopefully these folks can securely get access to the content from anytime, anywhere, from the device of their choice. Again, securely. Now, again, you get into issues of PII, and you shouldn't be able to get any sort of PII from your mobile device. But there's a lot of content that providers and healthcare givers can get, such as procedures, such as directions to a different facility they're going to, such to any kind of guidance they're looking for. All of that doesn't contain PII, and getting that into a mobile format and available to those individuals really goes a long ways to their overall productivity and eliminating barriers to quality of care. All right, so I'm going to jump into a demo I put together. Let's see here. Sorry, bear with me just 1 second.
While you change, may I ask a question?
Please.
So brief question. Now that you were interviewing and working with those all different persona types at the healthcare, what was the kind of most demanding role, in a sense, regarding information work tools? Anything you can elaborate for that perspective, so that obviously they have all the different roles, their different tools, their different practices, but if you think from the information worker perspective, any differences regarding the demands and then accepting the tools or something like that?
Yes, I'll give you a couple scenarios, and I'll give you a demo here in a second. But from an administrator coordinator perspective, the e-visit piece was very significant, because you just can't tell patients that or loved ones that they can't talk to each other. And also there's all kinds of studies about interacting with the people you love gives you a better chance of survival, et cetera. So coming up with a rapid solution for that was really significant. The other one was how do I set up and get access to space? If suddenly you're in a hospital that was designed for a certain number and your population's up, you've got to get creative. So how do we rapidly come up with a solution that allows for us to schedule a different operating room, not even so much surgery or anything like that. It's just like treatment rooms. How do I go and set up treatment spaces, which frankly could be a tent in a parking lot. It could be, a classroom in a school that's not being utilized, those sort of things. Folks have gotten very creative, but at the same time, you need a way to schedule that. You need a way to track it. You need to have that accountability and governance for as well. So those were two really hot topics with there. And then the other one they call procedures of care is like, how do I get the most relevant information right now about what's going on with, fighting this battle against COVID? What things are going on now? Should I be doing something different?
Exactly,
Yes. And how do I distribute and disseminate that content to, the right folks at the right time?
Cool. Thank you.
You're welcome. Okay, so I just put together, again, you all know Valo and you all know, SharePoint. So I don't want to go, you're going to know the news and, and the events and whatnot.
Just to make sure that you are sharing your screen.
Oh, my apologies. Sorry.
No worries.
Let me go back here. Oh, sorry. Teams is giving me a hard time. All right, there we go. All right, see you now?
Yes, thank you.
Right. So one of the big things when you're doing like shift change or check in or check out, there are different like websites or bulletin boards. There are different ways that a provider or a nurse um, or other folks can get information about what they're up against. But having a way to like give clear, this piece here was something that was very popular when I showed it, which is, hey, FYI, we're up 40% on intake, so be prepared. Make sure that you have what you need. If not, talk to your shift supervisor, etc. The quick, using the important messages component within Valo was, that was something that resonated because there's a lot of information, but knowing that first thing when I get on shift, what am I in for? What am I prepared for right there? And then being able to use, the news rotator and tagging content related to specific doctors and providers in terms of, hey, FYI, here's an article on this new treatment you should be available. Hey, FYI, you should discontinue your use of this one thing. Hey, FYI, we just got a bunch of masks, but they're, totally expired. Use at your own risk. That sort of, these are real life scenarios that, when I've talked with them. So being able to rapidly go in and use the Valo template and create a page that's disseminated on this page, but more importantly, targeting that content to specific user groups like doctors, like nurses, like administrators, was something that really resonated with a lot of the folks I talked to. Same thing with the events, what's coming up today? Do I have to worry about, oh, I got to go to that training thing for this new process that we have? I have to, be aware of that. So having all this front and center. So there really is this transition that happens between shifts and that passing of the baton. Now, this is a much broader digital workplace, but I can also envision a nursing work page space for shift changes. I can envision a provider one for the doctors taking over, and what's going on in their floor, their ward, especially if you have a focus such as COVID-19 and you want all that relevant information accordingly. Now, it's not always going to be as targeted as COVID-19 is right now. There's lots and lots of stuff that kills us, right, in the world that we have to be treated for in hospitals. And also, you can target that content based on oncology, cardiology, neurology, whatever it is. You can do targeted content. So that was something that really spoke to a lot of folks, is like having a page like this for each working group, each shift, each focus. And you would have to do more of, your requirements gathering analysis for that specific system, but that is definitely something that went over really well. I'm going to take a second to dig into the e-visit form. So this was pretty basic, but also very helpful. And I'm not sure if anyone's done this yet. Using Microsoft Bookings, setting up your services in Bookings for your specific center, and having the ability to go in and schedule an appointment to visit, with grandma or grandpa or your husband or wife or whatever. And, basically all this information here. Let's go through this really quick. 304. Yes. And again, I created this form in all of like 10 minutes. So it's pretty easy to go in and provide this kind of functionality. And I want to do MS Teams, and this is a birthday, and I believe they're on floor 3. Great. Now, obviously, this can be whatever information you want. So if you have multiple locations, if you have, you want to collect more information, it can be as complex or as simple as you want. But then when I do the booking, so I did this for the 30th, great, go book. Bam. So now I'll get an email confirmation in my inbox, which I just did, heard the ring. And there it is. There's my e-visit booking. And I see it's added right into my Outlook. And then here there's a link where I can also go in if I need to. I can reschedule or cancel the booking or create a new booking if I want to as well. So very simple, but very straightforward and very powerful. Then let's say, okay, so that's more on the family loved one situation with the patient, scheduling that up. But now you're going to manage all that. You got all these people submitting requests to see grandma and grandpa or whoever, how do you take care of that? And so you do that basically through your calendar. So all those requests, you can set up different resources and services. So here, for example, I have a service just for these bookings, but I could do a different service for, let's say that I'm a healthcare system and I have a hospital, I have 3 clinics, and I also have a nursing home. I could do a separate service for each one of those and distribute those links accordingly. If you want to visit grandma in the nursing home, click here. If your son or daughter is in the hospital, click on this one. So it's very easy to do that. And it creates a separate calendar for tracking all those activities here. And then you can color code these based on resources. Now, what it is imagine if if you will, that there is a video conference cart. And on that cart, you've got a television and you've got a webcam. And it's someone's job to go from room to room based on, what the schedule and set that up for them. And that's exactly what this does. So you can color code, let's say you have 6 resources doing that, you can cycle through those resources. When those resources are unavailable in the calendar, it just pulls the time or date. You can also, set your specific dates and time of when availability for visits, no visits after 7 p.m., whatever the case might be. But you can set up different services. Then, for example, if I look here in my Outlook here, you'll see here that, hey, this guy, Wylander, wants to do a visit, the patient name, and you can see it on your calendar because you're the resource. So this person, Jack, is the resource. So at these times, Jack's got to, here's basically Jack's schedule to go through and, set up these different e-visits for these for different patients going on. And that's all on his phone or her phone. And that's very easy to track. So kind of a simple thing with bookings, but a very powerful way. Now, the great thing is, if we go back to my calendar, let's go back here. It should, let's see here. Oh, I didn't click the box. Anyways, it will give you a Teams meeting in your calendar as well, and that will be the link you're doing over Teams free. Now, the one caveat, it is going to ask them to set up a Microsoft, their little simple account to get access to that. So that's a quick process. But once that's done, they don't have to do it again. But, there's no cost to it. And it's pretty straightforward to get up and running and set up. Also, it's secure because it's over Teams. You can have traceability, accountability, etc. So just a very big problem with a pretty simple solution. Just leveraging your, bookings, SharePoint, and Outlook. And then using InfoPath, you can suck that content now, and actually this just came available, but you can suck that content out of bookings and into a SharePoint list to have accountability and traceability for all the different things that you need to report on, like how many visits did you have, how many people were shows or no shows, etc. That information can get dumped into a SharePoint list, and you can set up Power BI or something like that to set it up automatically, to have a nice dashboard for it. All right. Another one, we talked a little bit about getting access to a space. So let's say I get a new patient and, they came in and, now we're outside the hospital, maybe we're in tents in the parking lot or we're in a secondary space and I need to set up a room. Now, again, the EMR is all set up to do that within the hospital or clinics, but again, you're reacting to a situation here. And that's really what we're talking about, right? Is how do we provide functionality that allows us to support and help them respond to these kind of different dynamic situations that come up. I could see this with a natural disaster. Again, I think pandemics are probably going to be with us for a while. So there's always going to be these newfound challenges, probably. And so helping them, set up these reactionary situations very quickly is easy to do. So now I'm going to go ahead and book a treatment room. And you'll see here, I've set it up that now this could be a list of available rooms, but I'm going to go on room 1. And, maybe this was for an exam. So this could be, without the time or with the time. So, but let's say you've got to do an exam of someone potentially with COVID. Then, okay, great. I need it right now. Oh, okay. They have to clean it. It's available now. and then you put all your information here again, and then you book it. Great. And they'll send an email to the requester, and they'll, get notification. And now what you could also do is, let's say that you need a confirmation on that space, but you also, you probably have someone who's going to be responsible for managing all of those different new spaces, tents, classrooms, whatever they are. So it's the same kind of thing. Here you have your calendar for your treatment space. And then, you can see all your requests for different rooms at different times here. And then you could go up and update, okay, well, is this person going to just be with us for a couple hours, or they're going to be with us for like 2 days? So you could start keeping availability of each room. And then all the rooms, I should have done more of these to show you, are color coded and also named like room 1, room 2, and room 3. So, and then you can confirm, either automatically confirm the space is available. I could also see triggering off a workflow. So let's say that there's a space and there's something that needs to happen before you can take that space, like say having it cleaned, having it sanitized. You could have an email trigger, then kick off a workflow that sends that off to a different team who's immediately responding to get that room up and running and going very, very quickly. So again, but still having all that transparency and governance available to you. All right. Next item I was going to talk about was, obviously, Valo's got some great, for, your provider directories, employee directories, finding the right people. This definitely came up with the temporary worker. Like, how do I find someone right now? This is harder than you would think in healthcare systems. So just having to be able to take advantage of this and setting up a format that's custom searchable, searching by job role, by specialty, et cetera, is a really big deal. All right. Next, so another big one that came up was supply management, which I was kind of surprised by, but I guess it's been really hard to get supplies in. And they have these very traditional mechanisms for entering supplies, getting them approved, etc. But again, it's a little bureaucratic. It takes a while, and they have a tendency of stockpiling things so they can kind of bypass the bureaucracy. Well, all of a sudden, when you're up 60% of your patient count, then that gets really hairy really fast. And then again, going back to these more emergency situations where I'm setting up in a parking lot, in a school, whatever, maybe I don't have VPN access yet to back to the hospital for my EMR, or maybe it's just too rigid to really adapt to the situation I'm in that moment. Well, for that reason, you could very easily again use forms and do a simple form. Now, I find that forms unto itself, unless you're doing a survey, is pretty I don't want to say useless, but it's basically a good mechanism to gather data. However, with InfoPath forms, you can do a lot with sorry, not InfoPath forms, with Power Automate. We'll back to the old school there. You can do quite a bit with forms. And so I just did a simple one. Again, you can have this pulled their AD account or whatever. I just did a quick one, and then I'm in cardiology, I'm in hospital 1, and you can do some branching logic in here, but I need some mass. And then these can get pretty complex pretty quick. I just want to do a quick demo. So then it kicks it off, and going back here, then what I did is I just had a simple Power Automate, suck that in to the supply management list. And so here's the one I just did. And then now, once you're pulling all that data from these requested forms, you can start doing quite a bit with it, right? You can manage the whole process here. You can set up dashboarding. You can set up alerts. You can associate, workflows in here pretty quickly. So pretty straightforward to kind of get in. And, again, I keep thinking this sort of triaging scenario where, hey, our current systems are too rigid. We didn't plan for this whole pandemic. How do we manage this? How do we deal with this? And just using some of these very basic tools, if you can think through the scenario and really talk with the client and figure out what their core challenges are, it's pretty straightforward to set up some of these emergency processes. Now, again, you got to think a little bit about things like HIPAA, but you can also take those preventative steps to ensure that you've got everything set up properly in 365 ahead of time, so that as things come out of left field, and you never know what they're going to be, because who knows, we could get hit by a meteor or something. But you're in a position to take advantage of some of these simple tools to rapidly respond to a lot of challenging situations, which I think is probably one of the coolest things that we can do in our roles, is to try to find ways to support people who have a lot of like major challenges day to day. And if we can do something as simple like, you can't get supplies, how do I help you with that? Great. Let's come up with a simple process. Or, hey, you need to set up an emergency facility to treat these people. Let's come up with a way to track it and set it. And let's do that like in a couple hours or a day, not in a month, and not, for an exorbitant amount of cost. Like, let's be able to react to your situation as quickly as possible. All right, I'm going to stop there and see if anyone has questions. I kind of have a tendency to talk very fast, but that's basically my story in a nutshell. So, of these just basic scenarios, I've implemented the treatment management one and the e-visit form for 2 different healthcare systems, and it's been very well responded and very helpful. So, and now I think that the one organization, I think they're doing something like 60 e-visits a day, and they expect that to grow exponentially. So, and this, I just implemented this a little while ago. So it's been kind of a positive way. I've really enjoyed getting in there and trying to come up with solutions to help folks to solve those problems. But the great thing about Valo is it's just such a great way to set this up. Yes, a lot of this is in 365, but then also wrapping a digital workplace intranet around it, where now I can search for content that I'm looking for. I can easily find that, the content, I can tag it, I can target it. All the things that we know that Valo does so well, using that as the framework that then you place these other pieces of functionality in, is just such a great win, and makes it very easy for the workers to rapidly get to what they want from any device, any location, anytime. They can get and schedule a room from a mobile device, or have someone schedule an e-visit and get a text message. It's all wrapped in there. But within Valo, you have this really wonderful container to put all this wonderful functionality into and take advantage of their functionality to provide a pretty comprehensive solution to help healthcare systems. And I think I'm at 41, so I'll probably a little ahead of schedule, but I think I'll open it up to some questions now if anyone has any.
Thank you, Perry. Really, really good stuff. Any questions from the people? I have a couple of in my mind.
Sure. Okay.
So one question which comes up to my mind is that when we come to work with the healthcare sector, and especially with the patients, and obviously the healthcare professionals, how about the security aspect? Any comments from the IT departments that no, you can't do this because we have our own legacy old systems which don't scale and which are not kind of meant for this, but they are hesitant actually to allow you to do the rapid deployment, because even if they know that, okay, what you showed, yes, it is easy, it is fast, but then they are afraid of the cloud, or they are afraid of something else which is not to be afraid of.
Yeah, absolutely.
Any responses?
Now, the only thing I would challenge in terms of, like, let's say PII, the e-visit was one where there was some concerns with that. But the organizations I work with, kind of went through with their security team and their compliance folks, and lots of stuff is in the cloud now, and they're getting there. And we kind of went through, and Microsoft obviously has a lot of white papers on this, and we were able to show them that this isn't going, you're not sharing too much PI. Now, the PI you're sharing, obviously, as we know that Jane Doe is a patient at your hospital right now, but we don't know what they're there for. We don't know any of their identifying information. We don't know, any of that. We just simply know that someone's trying to go visit this person at this time.
Yeah.
So that, there's a sliding scale for these things. And the two healthcare systems I worked with felt that that was an acceptable level, especially given the fact that they were able to get a solution up so quickly. So, the reality is, if, as we look at these things, and then there's also just additional things we can do, right, in terms of, getting access to this. Let's say you're not using it for e-visit. I mean, you can still, force VPN. You can do, have to be on the subnet to get access to the 365 environment. There's a lot of security things that you can do to really lock it down and make the folks feel in security. But I think the bigger point at this point is, look, how are you going to deal with this in the future? So, let's say that things, I mean, I'm hoping, it doesn't seem like things are slowing down now, but hypothetically, if things slow down, let's prepare your environment now so that if you have to react in the future, you're good. You can feel confident that, you've got everything set up as it should be in 365 and that you can take certain preventative measurements. But I have noticed a certain, not relaxations isn't, but a higher level of flexibility, because often, with security, the first answer is just no, we can't do that, right? Now the answer is like, we need a solution right now, like today, and so people are getting a little more creative, and I'm not aware of any breaches of this sort of thing, but again, it's always a risk. But yeah, it's always going to be a dance with those guys.
Yeah, and especially that the IT obviously is trying to diminish shadow IT, so they must be heavily involved with this. And but at the same time, I agree that with the Microsoft 365, in many cases, we can show a better track record on the compliance side that they can do on their on-prem, because they can have a detailed reports, for example, in which documents do they have actually social security numbers or other information.
Yep. But we're not talking about any of that data, right? We're just simply saying, hey, I want to come visit this person at this time.
Exactly. Yeah.
Yep. At which point, then the hospital coordinator takes over and they make sure that person's there, and they follow up with an email or potentially a phone call with the visitor, and maybe they want to make sure they're on the list. So the ability to kick it off doesn't necessarily have to be the final step. I think what you'll see, a lot of organizations will probably do follow-ups with the requested visitors as a quick check-in, just to vet them to make sure they're not some random person, et cetera.
Okay.
Yeah.
Good point. Any questions from the audience? Thoughts about the topic? Because I think during these weird times lately, we have all confronted something related to this.
I think everyone's ready for happy hour, man.
Yeah, it might be. It's been a long day already, so.
Okay.
But Perry, thank you so much. This was there were really good points, and at least I got some confirmation about the approaches, what we can do with Microsoft 365 and obviously with Valo from our perspective. So thanks for joining us.
All right. Well, thanks for having me, and I hope everyone has a good happy hour. Talk to you soon.
Thank you. Okay.
Bye.
Bye. So
Thank
next
you,
will be happy hour in 50 minutes.
Yes, and I'm just going to remind everyone to head over to the experience track for happy hour.
Yeah.
Will do. Thank you.
All right. See you guys there.
Thanks.
See ya. Bye.
Bye.
Thanks, yes.